Welcome to my channel Brainies. In today's video, I'm going to talk about the neuro assessment in neuro-oncology, shortly abbreviated as NANO. A multidisciplinary international committee of neuro-oncology experts, they developed a neurological assessment in neuro-oncology, which was termed as NANO. The scale was observed in the year 2017 to standardize the assessment of neurological functions in the oncology patients, especially the neuro-oncology patient. The nanoscale was aimed to provide an objective, quantifiable measure of the neurological function, complementing the already existing assessment tool, the RANO. This is the response assessment in neuro-oncology. So the neurological complications are a significant concern in cancer patients, impacting both the central and the peripheral nervous system. The complications can arise either from the cancer itself or its treatments like chemotherapy, radiation, or even the body's response to the cancer. The various neurological complications could be the brain metastasis, the peripheral neuropathy, the cognitive impairment, which is termed as chemobrain, the compressions of the spinal cord, the neurological paraneoplastic syndromes. So the main role of the neurological assessment is very crucial in identifying and managing these complications. So the assessments include the cognitive assessment, physical assessment, speech and language assessment, the cranial nerve assessment, and the assessment of the reflexes. These assessments can help the healthcare professional to identify the neurological problems at an earlier stage. Not only that, it has got so many other advantages. One of that is the differentiation between the various causes of neurological symptoms. For example, the back pain in the cancer patient might be due to the spinal metastasis. And it also develops an individualized treatment plan which is unique for each and every individual patient and basically crucial in monitoring the effectiveness of treatments. So let us see the domains of the neurological assessment in neuro-oncology. The various components are the nanoscale, which was developed in the year 2017. It assesses the neurological function in patients with brain tumors according to Oxford Academic 9 key neurological domains. The domains are as follows. The first one is the gait, which assesses the patient's ability to walk and maintain balance. The next is the strength, assessing the muscle strength in the limbs. And the next comes the upper extremity ataxia, which examines the coordination and control in the upper limbs. The next is the sensation, which tests the patient's awareness of sensory modalities, including the touch, temperature, pain, etc. The next comes the visual fields. It evaluates the range of patient's vision. The next one is the facial strength, which assesses the strength and symmetry of the facial muscles. The next is the language, which evaluates the patient's ability to communicate. The next is the levels of consciousness, assesses the patient's state of arousal and awareness. Next comes the behavior, which is the last but not the least domain, which evaluates for any alterations in the patient's behavior or mood. So each domain is being assigned a score based on the severity of the neurological deficit, with 0 indicating the normal function and the highest score 2 or 3 depending upon the domain, which represents the most severe deficit. So the nanoscale includes the options for marking the domain as not evaluated if the deficit is due to cause other than the tumor activity, and it can be marked as not assessed if the evaluation of the particular domain was omitted. So the neurological complications are very common in cancer patients and can significantly impact the quality of life of the patients. So a regular neurological assessment, which is an essential component of cancer care, which allows the early detection and management of these complications, ultimately contributing to the better patient outcomes and improved quality of life. That's it with my video. Thank you so much for watching. Kindly support by subscribing and sharing. Meet you all in the next video. Thank you once again.